additional correspondence I received that I'm sure others received, and it may be in this very large document, and I did get through a lot of it, Dr. Quist, I want you to know that, but not all of it. Just questions, excuse me, about more resources, more efforts in our schools and mental health, wellness and awareness in our schools. Could you comment a little bit on that? And if any of that is incorporated in here, maybe direct me to the specific citation.
Thank you. And again, what I'd like to emphasize is that MHSA is a very large component of what we do, but it's not all that we do. And so I've been in communication and in collaboration with a number of the advocates around our school-based mental health services.
Great.
And we are working very hard to implement as many of those recommendations as we can, but they're not necessarily, we don't necessarily have to use the MHSA funding to do a number of those initiatives. So we continue working very closely with SCOE. We used some of our, it was
public health funding.
Some public health funding in order to accomplish some of the goals. So we're finding ways to make it work and continuing to work along those regards.
Yeah, and we're about to engage with SCOE on a refresh of the 10-year strategic plan for how to increase school-based mental health services. It's something that we brought to the board that we're funding. So.
Great. I really appreciate that, and really great point for everybody who's listening here today, that it's not exclusive to just MHSA funding. The county is doing a lot in addition to that, in recognition that our students in our schools, obviously their mental health has been dramatically impacted by COVID. So, okay, thank you very much.
Thank you, Supervisor